Hi, I'm Dr. Andrea Beatles with Eye Associates, and I'd like to talk to you about macular degeneration. Macular degeneration is a disease of the eye that damages the macula specifically. And I have a model of the eye to show you where the macula is. Now the macula is in the retina, which is on the inside lining on the back of the eye here. And the macula is a spot right in the center that's responsible for your sharp, detailed central vision. So like if you're reading or if you're looking right at something, you're using your macula. And macular degeneration is age-related, so the older somebody is, the more likely they are to get it, specifically those who are greater than age 60. And in macular degeneration, it can be a sudden loss of central vision, or it can also be gradual depending on the severity and depending on the type that you have. Now, there are two types. There's dry macular degeneration and there's wet macular degeneration. And in the dry kind, that's the most common of the two, and it's also the least devastating to vision, fortunately. And it's just a very slow, progressive decrease in that central vision. You can see distortion maybe in your vision. Lines might look kind of blurry or wavy, so that's some of the things you could notice if you have the dry macular degeneration. Now the wet kind, that one is more devastating, unfortunately. And in wet macular degeneration, something a little bit different happens. Underneath the retina here, little blood vessels start to grow. It's called neovascularization. And those new blood vessels, they're not as strong as normal blood vessels are. They're very leaky and they're very weak. So they leak blood and fluid in the inside of the retina. And that causes swelling and causes damage to that tissue. And sometimes from that kind, you can get even loss of central vision. Now, these things, they can be slow, and they're usually painless. There's no pain involved, or it can be very fast as well. Now, during an eye exam, that's when your eye doctor can detect macular degeneration. So it's easy to see if you look inside the back of the eye. So that's something that if you have it, or if you're starting to get signs of it, it can be very easily examined for. Treatment for macular degeneration, it's different if you have the wet versus the dry. Now the dry kind, unfortunately, there is no approved treatment at this time for it, but studies are being done currently to develop treatments. You can, however, take vitamins to slow the progression. There are certain vitamins formulated specifically for the eye and the macula. There's a formulation called Ocuvite, and that has vitamins A, C, and E, and others, and that can help as well. And also two important nutrients found in the macula you can take in vitamin form, which are lutein and zeaxanthin. Now, in wet macular degeneration, that is the most severe, and fortunately there is treatment for it. And that's injections done inside the back of the eye, and those injections put the medicine right in the eye, right where those blood vessels are growing, and what they do is they prevent those blood vessels from growing in the first place, and they prevent them from breaking and leaking. So that treatment has proven very successful here recently. Now, prevention of macular degeneration, it is genetic, so if you have a family member with it, you are more likely to get it, but it doesn't mean you are going to get it, and there are a lot of things you can do to help prevent it. Number one is not smoking. They've shown a great link to smoking and macular degeneration. Also, ultraviolet exposure from the sun. Whenever you're outside, we recommend that you wear sunglasses that have UVA and UVB protection to protect the eyes from the ultraviolet rays. So make sure you are getting your eyes examined once a year to detect for any signs of macular degeneration.